Since the start of the COVID-19 pandemic, health departments, big and small, have relied on contact tracing to help mitigate the spread of the disease, hiring hundreds of people to do the work. But as we enter an endemic phase, the need for contact tracing and the work of people who did the job has changed. WTTW News reporter Kristen Tometz joins us now with more. And Kristen, first remind us what contact tracing is exactly and why health departments relied on it.
Sure. So contact tracing, as I've been told by several local health officials, is the bread and butter of public health departments. It's used as a sort of surveillance strategy for things like foodborne illnesses and many types of infectious diseases, including COVID-19. Contact tracers, in terms of COVID-19, inform people when they've come into close contact with someone who's tested positive for COVID-19. This allows people to be notified quickly, and they can either isolate or quarantine and get connected with any resources that they may need.
Now, the state and Chicago were entering a new phase of the pandemic. Will COVID-19 contact tracing efforts change?
Yes, they will, and they've already started to. Late last year, the state began centralizing its COVID-19 contact tracing efforts to take the burden off of local health departments. And this also just so happened right as Omicron was beginning to spread rapidly in the area. Local health departments are now focusing their resources on high-risk cases and settings like long-term care facilities, other congregate settings, schools, and any unusual outbreaks.
So at the start of COVID, obviously, Chicago hired hundreds of people to do the work. Will they continue to work for CDPH? What's next for them?
They will continue working with the city's community-level contact tracing program through the end of the year. Next month, the Chicago Cook Workforce Partnership, which was picked by the city to hire all those hundreds of people to do that community-level contact tracing, is actually hosting a career fair for everyone who's still working in that program. In addition, the city regularly informs participants about job openings. The goal is to make sure that when the program ends, it doesn't mean that's the end of a job, but instead a path to a career. Now, once that program does wrap up, the city does have plans to use a similar model for broader, longer-term health initiatives by having Chicago residents serve as sort of public health ambassadors.
Okay, so a shift for some of those folks as well. Kristen Tometz, thank you so much for joining us.
Thanks, Brandis.
And you can read Kristen's full story on our website. That's WTTW.com/news.